If you call 911 in Tulsa today, it might go something like this.
911, do you need police, fire, or medical?
I don't know. Maybe police? My sister is struggling. I think she might hurt herself.
Okay, thank you. Let me connect you with someone who can better assist you with that situation.
Hi, I'm a mental health provider with COPES. Let's talk about how we can get your sister some help.
This kind of response is now available in Tulsa if you call 911 for a mental health emergency. But that wasn't the case even a year ago. You call 911 because you or someone you know is having a mental health crisis and you don't know what else to do. The call taker doesn't have a lot of good options either, so they'll probably send a police officer to try to help you. Well, what's wrong with that? While some officers are trained on what to do in a mental health crisis, they aren't mental health professionals and can only do so much to de-escalate a situation. Plus, if you're suicidal or in psychosis, flashing lights and police sirens could make a bad situation feel much worse.
The Tulsa Police Department gets a significant amount of mental health response training, and they're still not the experts. So we really have to focus on sending the appropriate mental health professional or diverting that call where the best resources can be met for the individual that's calling.
Police are still the default responders for mental health crises in a lot of U.S. cities. But some bigger cities, Tulsa included, have found a better way. The ideal mental health crisis system has 3 core elements: someone to call, someone to respond, and a safe place to go. For most people, someone to call is enough when they're in a mental health crisis. They can get the support they need over the phone. But sometimes, someone might need an in-person response, and in that case, a mobile team can go to them wherever they are. For people who need more support, they might need to go to a crisis center where mental health professionals can help them feel more stable and maybe even start medication. Tulsa had all of these elements, but they weren't streamlined or coordinated. If you didn't know where to start, there was a good chance you might not end up in the right place. Enter Tulsa's First Responders Advisory Council. We call them FRAC. FRAC is a collection of leaders from across Tulsa's public safety departments, including police, fire, and 911, working alongside mental health experts from Family and Children's Services, and us, Healthy Minds.
We needed a plan. People weren't, the leaders in the system, they were talking on an ad hoc basis when they needed to, but really looking into the future and defining our needs, figuring out what Tulsans needed, that needed to be done in a more coordinated, formal way.
Recently, FRAC has been working to map out a better, more coordinated crisis system for Tulsa. One of their major achievements was embedding mental health professionals at the city's 911 center.
When someone calls 911 in the middle of a crisis, they don't always need sirens, but we know they always need some sort of support.
Now, when people call 911 for help, but they don't need a police, fire, or medical response, call takers can hand these calls over to mental health professionals who can help these callers navigate the problems they're dealing with, often entirely over the phone.
It allows for law enforcement to focus on the other issues in the community. It also really helps ensure that we can reduce escalation or arrests or unnecessary hospitalizations in the community.
But why is all of this needed if people can just call 988? 988, the 3-digit code call in a mental health emergency, launched nationwide in 2022. It's a great tool, and in Oklahoma, it's the ideal way to connect you with those 3 elements of the ideal crisis system. But 988 is still relatively new, and not everyone knows about it. 911, on the other hand, has been around for a while. We've been taught ever since we were kids to call 911 in an emergency.
988 and the COPES crisis line are essential resources in our community. But sometimes an individual who's experiencing a crisis or their loved ones will by instinct call 911. It allows individuals in Tulsa to have, again, that right service at the right time.
So, how's it all working? In just a few months, mental health professionals have handled about 3,000 calls that otherwise would have required a police, fire, or medical response.
It's better for the public, it's better for officer safety, and it's better for the citizens that are calling in for in mental health crisis.
And that translates to roughly $90,000 and well over 1,500 hours saved for police officers, firefighters, and medical responders.
The reality is, the course of somebody's life is dramatically altered by who responds to them in a mental health emergency. And sometimes it doesn't need to be our traditional police officers who need to go fight crimes. Sometimes it doesn't need to be medics and firefighters. And sometimes it does. So figuring out who needs to be there during what kind of crisis really matters, because it could be the difference between living a full and productive life and going to jail or the emergency room when you don't need to, and racking up those medical bills.
Already, city leaders see the embedded mental health professionals at the 911 center as an indispensable part of Tulsa's crisis system.
Tulsa is leading the way nationally in how we respond to mental health crises as a community. It's not perfect, it's a new system, and we're working on it every day, we're improving it. But we have a lot to be proud of, how far we've come, and I think the future is bright.